Hello, I'm Jason Popp, a healthcare litigator at Austin and Bird, and with me today is my colleague Andrew Liebler. Andrew, tell us what's been going on in telehealth lately.
Thanks, Jason. With the ongoing pandemic and the relaxing of various telehealth regulations, we've seen a major uptick in telehealth utilization in 2020. The favorable regulatory environment for telehealth this year has given telehealth a major boost, as telehealth services can now be furnished to all patients in all settings where clinically appropriate. On the reimbursement side, CMS has approved new billing codes for the reimbursement of telehealth services. But the telehealth boom has also coincided with increased regulatory scrutiny and enforcement activity. And that activity is headlined by the Justice Department's recent announcement of its largest ever healthcare fraud enforcement takedown in connection with over $6 billion in allegedly false healthcare billings. Now, importantly, of that total, more than $4.5 billion was connected to suspected telehealth fraud. These new cases give us an insight into a number of key areas of risk and liability for telehealth participants, including telehealth marketing, unnecessary medical services, the propriety of patient referrals and provider compensation, and the government's willingness to prosecute corporate executives in their individual capacities. So, Jason, what best practices should telehealth participants keep in mind as they go forward here?
Well, Andrew, you mentioned at the top that CMS has cleared many of the telehealth obstacles during the public health emergency. Now, it's important to know that these relaxations are not permanent. And when the pandemic ends, which we hope is sooner than later, it'll be important for providers to make sure that their operations comply with the post-pandemic regulations. Now, second, Andrew, I think you know government enforcement actions will only increase in the years to come. By the year 2027, it's expected that the US telemedicine industry will reach $26 billion, much of that coming from federal insurance programs like Medicare. So that will naturally draw close scrutiny by government enforcement agencies and plaintiffs' attorneys alike. So we recommend that healthcare companies and providers adapt for that and elevate telehealth as a risk priority in their compliance and auditing measures. For more on all of this, we hope that you'll read the link below. Thanks for joining us today.